New at 5, a walkout at McLaren Macomb. Hundreds of workers now on the picket line.
They are officially on strike over pay and what unions call dangerously low staffing levels. Fox 2's Ingrid Kelly is live with what's unfolding right now. Ingrid, we can see quite the crowd behind you there.
Well, hey, guys, you know, these workers, they've been out here since 7 o'clock this morning. They're making their voices heard, and they say they're not backing down.
It's a fight for change.
This is a 3-day strike, and the hospital informed us at 10 o'clock last night we are locked out until 06:59 Saturday morning.
Hundreds of workers from McLaren Macomb Hospital walking the picket line, speaking out against a number of issues, including stalled contract negotiations and low wages.
We have a staffing matrix that they violate regularly. We have a penalty pay that they want to take right out of the contract, so there's no accountability for the nurses.
Treatment of support staff also under scrutiny.
For the service group, these are the folks who draw your blood. They register you when you come into the hospital, and they sit with you when you're not safe to be alone. And these people are making poverty wages. Some of them qualify for Medicaid or for SNAP benefits.
The union representing the workers also concerned about the use of replacement workers, says the hospital will remain fully open and operational during the strike.
The temporary nurses, they come in from out of state. And I want to be very clear, Michigan has higher standards than many surrounding states.
Fox 2 reached out to the hospital for an on-camera interview, but received a statement which reads in part, "The union's decision to take its members on strike is a truly regrettable development, considering the hospital put forth an offer that includes a wage increase that creates a market-leading compensation package, nationally benchmarked staffing ratios, and qualified benefits."
This is a story of a big corporation coming into a community hospital and running it like a business.
All right, back out here live. Despite what you see and hear right behind me, again, this hospital is fully open and operational. And so if you have to pay a visit here to the hospital, you absolutely can. These workers, they're going to be out here until 7:30 tonight. Back to you in the studio.
Well, you know, so much of what they have to say and what we see on those signs is that patient safety has to be the first priority. And you do worry if staffing levels are not what they should be. Any one of us could be a patient at any time.
Okay, Amy, say it again, please.
I was just saying, Ingrid, that so many of the folks out there are worried about patient safety. And really, as patients, any of us could be a patient. That should concern us, too, in terms of staffing levels.
If I'm hearing you correctly, yes, patient safety is absolutely one of their main complaints. They feel like they're overworked and staffing is insufficient. And so when people come here, they wonder about their care. But again, the hospital stands by their staffing levels, and they say that if you come here, that you will get first-rate care. Back to you.
All right. Thank you, Ingrid. Appreciate you. Hopefully they get things worked out soon.